welcome to the deep dive. Today we're tackling Trichomoniasis vaginalis infection, or TRICH, as it's often called.
Yeah, chich.
Think of it as a really common sexually transmitted infection, an STI, that, well, sometimes doesn't get the airtime it maybe deserves. Our mission here is basically to give you a clear, high-yield rundown of TRICH for, effective revision. We're drawing straight from our notes so you can get up to speed fast.
Exactly.
We know talking about STIs can feel a bit overwhelming sometimes, loads of info, so we're here to break down the key stuff.
Yeah, just extracting what you really need to know. It's something you'll likely encounter, so having the key facts ready is super helpful.
Yeah, let's get into it then. What exactly is Trichomoniasis vaginalis infection? What's the basic story?
So fundamentally, trichomoniasis is an STI. It's caused by a tiny single-celled organism called Trichomonas vaginalis.
Okay.
It's a type of protozoan. Think of it like a microscopic critter, and it has these little whip-like tails, flagella, that help it swim around.
Right.
It mainly sets up shop in the urogenital tract. That's your urinary and genital organ system.
Yeah.
And this can lead to inflammation, discomfort in both men and women.
Okay.
Now, here's a really, really important point. Trichomoniasis is one of the most common curable STIs globally.
Curable, that's huge.
It is. That's a massive public health point, a common STI that we actually have good treatments for.
Definitely key. So this trickster bug, how does it actually spread? What's the etiology?
Well, the culprit, like we said, is Trichomonas vaginalis.
Okay.
And the main way it gets around is through sexual contact.
Right.
So vaginal, anal, or oral sex. It's a direct transfer of the parasite during sex.
Makes sense.
There's also a less common route vertical transmission, so from mother to baby during childbirth.
Ah, okay.
But in adults, it's almost always sexual intercourse.
And where does this parasite prefer to, live in the body?
In women, you typically find Trichomonas vaginalis in the vagina, the urethra, the tube urine comes out of, and also these little glands near the urethra, the periurethral glands.
Okay.
In men, it usually sticks to the urethra.
Okay. So who's more likely to get TRICH? What are the main risk factors we should be thinking about?
Right. Several things increase the risk. The biggest one and the most important for prevention is unprotected sex.
Right. Condoms.
Exactly. Not using barrier methods really bumps up the chances. Having multiple sexual partners is another major risk factor, just more exposure opportunities. Also, if you've had other STIs before, that puts you at higher risk. Interestingly, people with compromised immune systems might be a bit more susceptible.
Okay.
And as we sort of touched on, it's diagnosed more often in women than in men.
Right. So the parasite gets in, then what? What's the pathophysiology? How does it actually cause the problems?
So once Trichomonas vaginalis gets into the urogenital tract, vagina, cervix, urethra, even the prostate, it starts to, attach itself to the lining, especially the vaginal epithelium in women.
Okay.
These parasites, they move around with their flagella, and sticking to the lining triggers inflammation. It can cause some damage to the tissues there.
And we know exactly how.
Well, the precise molecular mechanisms, how it exactly causes that damage, that's still being researched,
Ah.
Understanding that better could lead to even smarter treatments down the line. But the main takeaway is if you don't treat it, the infection can hang around and cause ongoing inflammation and problems.
Okay, so if someone has symptoms that sound like TRICH, what else could be going on? What's the differential diagnosis? What else is on the list?
That's a crucial question, absolutely. Because the symptoms can really overlap with other conditions. For women presenting with vaginal discharge, you have to think quite broadly.
Right.
So common things are other vaginal infections like candidiasis, that's a yeast infection,
Yep.
and bacterial vaginosis, BV. Then you've got other STIs, chlamydia, gonorrhea, herpes simplex. They can all cause discharge or similar symptoms.
Okay, quite a few infectious causes.
Yeah, and then there are non-infectious things too, like just normal physiological discharge, irritation from soaps or douches, maybe a forgotten tampon.
Oh, right.
Changes during pregnancy, something called cervical ectropion. In older women, postmenopausal atrophic vaginitis that's due to lower estrogen can cause similar symptoms.
Okay.
And finally, maybe discharge after some kind of gynecological surgery.
Wow. That's a pretty long list for women. What about for men? Less common, but what else?
Yeah, for men, the differential diagnosis might include other things causing prostatitis inflammation of the prostate gland.
Okay.
Or sometimes urethritis from something other than trichomonas. And maybe cystitis bladder inflammation could have some overlapping urinary symptoms.
Got it. So Important to rule those out.
Mm.
Now, how common is this? What's the epidemiology look like, say, in the UK and globally?
Well, in the UK, we don't actually have precise national figures for trich prevalence. It's not tracked as closely as some others.
Okay.
But when you look globally, it's clear this is a massive issue. Millions and millions of cases every single year.
Wow.
In the UK context, we know it's more common in sexually active people, especially those with, higher numbers of partners.
Makes sense.
Globally, it's often cited as the most common curable STI. The WHO estimated something like 156 million new cases back in 2016.
156 million.
Yeah, that was nearly half of all the new curable STI cases that year. Huge numbers. In the U.S., a study from 2018 found it in about 1.8% of women and 0.5% of men aged 18 to 59.
So quite a difference between men and women there, too.
Definitely. And what's really interesting or maybe concerning is why it's still so prevalent when it's curable with common antibiotics.
Yeah, good question.
Things like lack of awareness, the fact it's often asymptomatic, especially in men, limited access to testing, maybe stigma, they all probably play a part.
Right. So let's talk about those symptoms, or lack thereof. What are the actual clinical features? How does it typically present?
Okay, so it can look quite different in women versus men. In women, the vaginal symptoms are often front and center.
Like what?
Things like itching, burning, general discomfort down there.
Yeah.
A classic sign, though not always present, is a vaginal discharge that's often described as yellow-green and frothy.
Frothy.
Yeah. And on examination, a doctor might see inflammation, redness, swelling of the vulva and vagina, that's vulvovaginitis, and sometimes this strawberry cervix appearance.
Strawberry cervix.
Yeah, it refers to these tiny red spots, like little pinpoint hemorrhages on the cervix. Also, the vaginal pH is usually higher than normal, over 4.5. Some women might also get lower abdominal discomfort and painful urination dysuria.
Okay. And men? You said often asymptomatic.
Exactly. That's a really key point for transmission. Men often have no symptoms at all.
Wow.
So they can unknowingly pass it on. If they do get symptoms, it might be urethritis, inflammation of the urethra.
So pain with peeing.
Yeah, dysuria, maybe some discharge that isn't from gonorrhea, so
Yeah.
we call it non-gonococcal urethritis. But usually when you examine them, there are no obvious abnormal signs.
No.
It's also worth remembering that the symptoms women get with trich can sometimes mimic bacterial vaginosis, BV.
Right. Overlaps again.
Yeah. And it's crucial to remember that a big chunk of people, both men and women, maybe 10 to 50%, have no symptoms whatsoever.
That's a huge range. So if you suspect trich, how do you actually nail the diagnosis? What are the investigations?
There are a few ways. An older method is microscopy. You take a sample of vaginal or urethral fluid, put it on a slide, and look under the microscope for the live, moving parasites.
The motile trophozoites.
Exactly. The key is motile. You need to see them wiggling. But you have to look quickly, usually within about 10 minutes of taking the sample, otherwise they stop moving.
Practical point there. What else?
There are rapid antigen tests available too, but really the most accurate method now, the gold standard because it's super sensitive, is nucleic acid amplification testing. NETs.
Yes, like for chlamydia and gonorrhea.
Precisely. These tests detect the parasite's genetic material, DNA or RNA. They're very good at picking up infections, even low-level ones.
And getting the sample is just a swab.
Yep. For women, usually a high vaginal swab. For men, a urethral swab.
Okay. What about checking if treatment worked?
Yeah, if someone's symptoms hang around after treatment, a repeat test, a test of cure, might be done. It's also generally recommended that women diagnosed with trich get tested for other STIs too.
Good point.
And because it is an STI, informing and testing sexual partners' contact tracing is vital to stop it spreading back and forth.
Makes sense. But we don't routinely screen everyone without symptoms.
Generally, no. Routine screening of asymptomatic people isn't broadly recommended currently, unlike, say, chlamydia in some groups.
Right. Okay, so we found it using, say, a NAT test. How do we get rid of it? What's the management plan?
The main treatment is oral antibiotics, usually metronidazole or tinazole.
Okay, antibiotics.
Yes. And a really, really critical principle here is treating both the infected person and all of their sexual partners.
Even if the partner's tested negative or have no symptoms.
Absolutely. Treat the partners regardless because of the high rate of asymptomatic infection, especially in men, and the risk of reinfection.
Okay, that's crucial.
It is. And during and after treatment, it's important to avoid any sexual contact for at least a week after everyone has finished their medication and until everyone is symptom-free.
Got it. What are the specific drug regimens used in the UK?
Commonly, it's a single large dose of oral metronidazole, usually 2 grams taken all at once.
Simple enough.
Or another option is metronidazole at a lower dose, like 400 or 500 milligrams twice a day, but for a longer duration, maybe 5 to 7 days.
Okay.
If metronidazole doesn't work or someone can't take it, then oral tenidazole, often as a single 2-gram dose, might be used.
Right, and you mentioned partner treatment, absolutely essential.
Can't stress that enough. And alongside the meds, advising on safer sex practices, condoms, reducing partners is key for prevention going forward.
What about specific situations like pregnancy?
Good question. Metronidazole is generally considered safe to use during pregnancy and also during breastfeeding.
Okay.
Though typically the high single-dose regimens are avoided in pregnancy, the longer course is preferred. Tinidazole, however, is usually avoided during pregnancy. And it's worth noting that oral treatment, taking the pills, is much more effective than trying to use topical creams or gels for TRICH.
Systemic treatment is needed.
Exactly. And one final point on treatment, we are starting to see some cases of Trichomonas strains that are resistant to metronidazole and tinidazole. It's not widespread yet, but it's something to be aware of.
Uh-oh. Drug resistance. Okay, so once someone's treated, what's the outlook? The prognosis?
Generally, it's really good. The prognosis after treatment is excellent. The infection is curable.
That's the main thing.
Yeah. Symptoms usually clear up pretty quickly, within days to maybe a couple of weeks. But, and it's a significant but, you can get reinfected easily if you're exposed again.
Ah, so treatment doesn't give you immunity.
Not at all. So continuing safe sex practices is vital. Regular STI checks, especially if you're in a higher risk group, and using condoms consistently help prevent recurrence.
Okay.
Interestingly, in some men, the infection might actually resolve spontaneously without treatment. Yeah, but treatment is still necessary to stop them passing it on and to prevent potential complications down the line. Don't rely on spontaneous clearance.
Got it.
Cure rates with metronidazole are generally high, 90–95%. But like we said, repeat infections are pretty common in sexually active people, often due to untreated partners or new exposures.
And you mentioned it links to other STIs.
Yes, having trichomoniasis seems to increase your risk of both acquiring and potentially transmitting other STIs. That includes HIV, gonorrhea, HPV, herpes, chlamydia. It underlines why comprehensive STI testing is often a good idea if one infection is found.
Right. Which brings us to complications. If TRICH isn't treated, what are the potential long-term issues?
Yeah, this is important. Untreated trichomoniasis has several significant potential complications. A major one is that it increases the risk of acquiring and transmitting other STIs, particularly HIV.
Okay, the HIV link is serious.
Very serious. It seems to make the genital tract more susceptible to HIV infection. In pregnant women, untreated TRICH can lead to adverse outcomes like preterm birth, the baby being born with a low birth weight, and premature rupture of the membranes, the water breaking too early.
Wow, serious risks in pregnancy.
Definitely. There might also be an increased risk of the mother developing a severe infection after delivery called postpartum sepsis.
Okay.
And as mentioned, it can enhance HIV acquisition. We talked about recurrent infections being common, partly due to lack of routine screening, maybe the infection becoming chronic in some, and that potential for drug resistance.
And for men specifically?
In men, untreated TRICH can potentially lead to prostatitis. And there's some emerging research suggesting a possible link between Trichomonas infection and a higher risk of developing clinically significant prostate cancer later on.
Prostate cancer, wow.
Yeah, it's an area of ongoing research, but it's a potential long-term concern. So again, that HIV risk increase is a major public health reason to diagnose and treat TRICH. And it's worth highlighting again, routine screening isn't as widespread as for some other STIs.
Okay, so let's try and wrap this up. Trichomoniasis.
Yeah.
It's common. It's caused by a parasite. It's curable with antibiotics.
Yeah.
It shows up differently, often no symptoms in men, which helps it spread. If left untreated, it can cause issues, including increasing HIV risk and problems in pregnancy.
That's a good summary.
And the keys seem to be safe sex and making absolutely sure partners get treated too.
Crucial point.
It really does make you wonder, doesn't it? Given how common it is and these potential links to serious things like HIV and maybe even prostate cancer, why isn't screening for TRICH more routine? Something to think about.
Absolutely. A very valid question. Understanding this condition properly is just so important for individual health and for wider public health, too.
Definitely. Well, for more in-depth MSRA revision resources like this, you can head over to PassThemSRA.com.
And don't forget, you'll also find some really valuable free materials over at freemsra.com.
Great stuff. Thanks for taking this deep dive into trichomoniasis with us today.